We are the students from the College of Nursing Batch 2022
from the University of Southern Philippines Foundation.
We are going to demonstrate how to take vital signs
and the proper body mechanics.
Keep watching!
In assessing for vital signs, we will need to use some apparatuses for the assessment. We will need to use digital thermometer for assessing body temperature, wristwatch for pulse and respiration, stethoscope and aneroid sphygmomanometer for assessing blood pressure.
Vital signs. Vital signs are the body's indicators of health. Usually, when a vital sign or signs is abnormal, something is wrong in at least one of the body systems. In assessing a client's vital signs, as a nurse, greet the client first and foremost.
Hi ma'am, good morning.
Then, introduce yourself to the client and confirm his or her identity by asking for her name.
Ako din sa Ayla Marie Matugas ma'am, ang nurse na naka-assign mo. Unsa gani ang pangalan nato ma'am? Cristal Sigonia.
Explain then to the client the procedures you're going to perform.
So, magkuha ko sa mga vital signs ma'am, sa mga temperature, sa mga pulse rate, sa mga respiratory rate, sa mga blood pressure, to know kung unsa ang condition sa imong health karon.
First step in assessing a client's vital signs is checking her body temperature to know if the client has any signs of hypothermia or hyperthermia wherein heat serves as the baseline of the other vital signs. But before proceeding to measuring her temperature, you first need to follow several proper sanitation techniques in order to prevent transfers of microorganisms. Clean hands with alcohol before touching anything. Next, check the thermometer if it's working. Before inserting the thermometer, gently raise the client's arm and dry up first the axilla using a dry cotton ball for accurate reading. Because if it's wet, it might cause inaccuracy and fluctuation of the reading. Now, gently insert the thermometer on the axilla and slowly put down the client's raised arm. To save time, while waiting for the beeping sound of thermometer, assess the client's pulse rate in order to know the flow or circulation of the blood. To do this, trace the client's thumb down to the wrist using the finger pads of your index and middle finger. Palpate the radial pulse. After 1 minute, keep your finger pads on the client's radial pulse and gently put the client's forearm on top of his or her abdomen. This is now how you assess the respiratory rate. Likewise, with the pulse rate, observe or feel every rise of the patient's chest or abdomen for 1 minute. Respiratory rate is important to check if there are any possible abnormalities in the client's respiratory tract. Slowly get the thermometer on the client's axilla and record the aforementioned vital signs for future references and database. Gently insert the arm in between the cuff. While wrapping the less dominant arm of the patient with cuff 2 inches above the antecubital space, ask the client his or her previous blood pressure to serve as the basis of up to where you have to pump the bulb. Ask the client his or her previous blood pressure to serve as the basis of up to where you have to pump the bulb. If ever the client does not know his or her previous blood pressure, automatically pump up to 150. Locate the brachial pulse, which is on the opposite side of the radial pulse. Then, get the stethoscope and place the earpiece onto your ear. Check if it's working by tapping the diaphragm. And then insert the diaphragm to where the brachial pulse is located. Next, place the manometer wherein it is easy for you to read. Close then the valve of the sphygmomanometer and slowly pump the bulb until the Close then the valve of the sphygmomanometer and slowly pump the bulb until the appropriate pressure. Then slowly release the valve and take the reading. The first Korotkoff sound is the systolic. Then slowly release the valve and take the reading. The first Korotkoff sound is the systolic pressure or the contraction of the ventricles, and the last Korotkoff sound is the diastolic pressure or the relaxation of the ventricles. Tell the client the results of his or her vital signs and offer your health education.
So, ang imuhang results sa vital signs, ma'am, kay imuhang body temperature kay 38.5 degrees Celsius. So, slightly fever lang ni siya, ma'am. So, increase fluid intake, especially water for proper hydration. Nya, ang imuhang pulse rate o respiratory rate kay within normal range ra pud siya. So, ang imuhang blood pressure kay 110/70 mmHg, which is normal ra pud siya, dili ka hypertensive o hypotensive.
In this video, we will demonstrate body mechanics. Body mechanics is an efficient, coordinated, and safe use of the body to produce motion and maintain balance. The purpose of body mechanics is to facilitate a safe and sufficient use of appropriate group of muscles.
The first body mechanics is sitting. The head is erect. The neck and vertebral column are in straight alignment. The feet are supported on the floor, and the forearm are supported in the armrest, in the lap, or in the front of the chair. The second body mechanics is standing. Head is erect and midline. Body parts are symmetrical. The spine should be straight with normal curvatures. The cervical concave, thoracic convex, lumbar concave. The knees should be straight, lined between the hips and ankles and slightly flexed. The feet should be flat on the floor and pointed directly forward and slightly apart to maintain a wide base of support. Mechanics is walking. The head is erect. The cervical, thoracic, and lumbar vertebrae are aligned. The hip and knees have appropriate flexion, and the arms swing freely in alternation with the legs. Third body mechanics is lifting. Tighten stomach muscle and tuck pelvis. This provides balance and protects the back. Bend at the knees. These help to maintain the nurse's center of gravity and let the strong muscle of the legs do the lifting. Keep the weight to be lifted as close to the body as possible. This places the weight in the same plane as the lifter and close to the center of gravity for balance. Avoid twisting. Twisting can overload your spine and lead to serious injury, but rather move your feet. The last part of body mechanics is to reach an object overhead. Use a safe, stable step tool or ladder for elevation. Avoid standing on tiptoes with the feet together. This decreases the base of support, elevates the center of gravity, and decreases balance. Stand as close to the shelf as possible. This decreases the amount of time the nurse must support the weight of the object with the arms. Transfer the weight of the object from the shelf to the arms and over the base of support. This maintains the nurse's base of support and aligns the weight of the object close to the nurse's center of gravity.
Vital signs. It provides data that can be used to determine the client's usual state of health. It also helps the nurse in developing the plan for care and serves as a life-saving measure for many patients, important preventive measure. It also serves to measure the patient's rate of recovery and the nurse to identify the nursing diagnosis. It is also important to the nurse to evaluate the success with the vital signs of return to normal rate. Use of body mechanics. It helps to protect your back and allows you to use body in a safe way. It is also important to conserve the maximum energy by preventing strain, also to provide maximum comfort and relaxation. It is also to avoid excessive fatigue and to aid in normal body functions. Also, to avoid skeletal